I will talk about the femoral tunnel technique. And will show some steps in the femoral tunnel techniques as we go from arthroscopy, just briefly, arthroscopic reconstruction of the ACL and femoral tunnel technique. So this is how we drape and prepare the patient. Diagnostic arthroscopy is must to know about all the pathologies, because this is not ACL only. There may be concomitant pathologies which can be missed if we don't do arthroscopic of the knee. In this case, you can see this is the torn ACL. The stump is there. The femoral remnants are missed, and the tibial remnants are there. This is the PCL, which is intact, and you can see this very much tight. Shaving the footprint on the femoral side to know about the landmarks on the femoral side. So we start shaving with a shaver. This is the femoral footprint, and we shave it till the posterior cortex, so that we can reach up to the anatomical landmarks, and we could see the ridge or feel the ridge over there. You can see that after removing the femoral remnants, there we can feel the ridge as well with our. In this video you can see, this is the area, a bit dim, but later on it will be clear. This is the posterior wall. We can reach up to there, and then we can come to the femoral footprint, and you can see the clicking of the probe over the ridge. So we have to go posterior to that ridge. So that is the anatomical point where we have to reconstruct. So this can be diagrammatic representation of the point, which is aiming. The femoral guide is necessary. This is the femoral guide, and this is in accordance with the graft size. There are different sizes of the femoral guide, and this is the flip cutter. So we use this. Usually we can do it freehand as well, but for the beginners, this is good to use the femoral guide because you can blow out the posterior wall. So this femoral guide, and this we use inside the knee. Passing the femoral guide, you can see that this the femoral guide is there, and the flip cutter is now going, and the femoral guide will give you a safety not to blow out the posterior wall because it is in accordance with the graft size. So the lateral position of the guide should be in the interior 1/3 of the thigh. You can see it should be in the interior or should be in the middle, but shouldn't be in the posterior. As we go posteriorly, there is much chances of femoral blowout. So this tunnel drilling, and when we enter, it should make sure not to damage other structures while making the femoral tunnel, because the posterior, the PCL is very near in this vicinity, and once the tip of the reamer goes inside, then you have to go stepwise, not to blow out all the cortex, because we need the cortex for the button fixation, cortical button fixation. So we go step by step, and we reach 25 or 30 mm tunnel is drilled as needed or as measured according to graft size. So the femoral tunnel is, now you can see this is the femoral tunnel, and you can check all around, and you can remove all the debris which is inside the femoral tunnel. So removing all the debris, and you make sure that there is no blowout in the femoral tunnel. Graft with RT, this you can make graft with RT, the graft shuttling. So it's another the graft shuttling that I'm going fastly because of the time constraints. The graft position, you can see, this is the graft position, the PCL and the ACL, which is from the tibial remnants. Thank you all.
Thank you very much.